I am joined now by Johanna Diekman. Thank you so much for sitting down with me today.
Yes, it's a pleasure. Hi.
Well, we're discussing something very exciting. You are an award winner, Image of the Year. What does that mean? Take me through it.
Yes, I mean, first of all, congrats, and we are very, very proud and happy to receive this award. And also would like to thank the scientific committee for considering our abstract for this important award. And yeah, the whole Hanover team is really excited about that.
Oh, congratulations.
Yeah, thank you.
When did you find out?
I think it was 2 or 3 weeks ago.
Okay.
Yeah. So I knew a little bit beforehand, and yeah, but I had to keep it a secret.
Of course, I know. Even now, people don't know. We're kind of
that's
announcing
true.
it.
Yeah. No, I'm very happy about it. It's a great honor.
So tell me about the award and the image itself.
Yeah. So this year we have a cardiology image, which is kind of, new maybe. It wasn't a cardiology image for the last couple of years, so we are proud of that also. And what we did is we looked at cardiac healing processes after an injury, so after acute myocardial infarction. And we studied patients who were admitted to our hospital in Hanover and underwent revascularization therapy there. And we wanted to look at the complex cellular processes that are induced after that by using the molecular imaging. And there are these new FAPI tracers. These are specifically visualizing activated fibroblasts. And these are cells that are very important for various healing processes throughout the whole body and also in the heart. And so what we did is that we looked at the heart with the FAPI tracer and found a high specific uptake in the infarct area, but also in the surrounding heart. And these tracers were primarily designed for oncologic imaging from our colleagues in Heidelberg, also in Germany. And they also kindly gave us a precursor for that, and also their thanks to them. And it worked out very well, and we see a good uptake also in the heart with this specific new tracer. And maybe important, the specific molecular target where these tracers are binding is the fibroblast activation protein. This is protein on the cell surface of these activated fibroblasts. Yeah, and this had a really high and specific uptake in the myocardium.
So what are we seeing specifically in the image?
Yeah, so we have here a patient example of our patient cohort, and this patient had an anterior wall myocardial infarction. As you can see in the top row, this is the myocardial perfusion spec, a standard examination for perfusion imaging. And we see a matching area of injury in the cardiac MRI. And then we see in the middle row the FAPI uptake, and this is by far exceeding the core infarct zone. And this means that we think there's not only fibrosis in the reparative fibrosis, but also interstitial fibrosis in the surrounding tissue. And this you can see very nicely in our exemplary image.
And why is that significant to capture that part of it?
Yeah. After acute myocardial infarction, the cascade of repair is induced. And in some patients, we also see, besides there is a good acute treatment with a revascularization and also a highly standardized treatment for the heart attacks, but these early cellular changes that occur or reparative processes, these are undertreated. And so it would be good to have some kind of easy accessible tool or predictor to see which of these patients will undergo something that we call adverse cardiac remodeling. That means which patients and why will have a heart failure after heart attack several years later maybe. And what we found is that the amount of or the volume of the myocardial FAB signal we measured there had a significant inverse correlation with the later function of the heart. This means maybe we have some kind of new predictive imaging here and could be able maybe to identify patients early that will later suffer from ventricular dysfunction.
Wow. Oh my gosh. How does it feel to have found that and be able to tell others in your field?
I mean, it's really exciting. Also for me, it's the first greater award to receive here, and I think this is something really essential and new, and also it could change a lot of things in the field of cardiac nuclear medicine and give new fields where we could use, for example, fibrosis PET or cardiac imaging in general, for example, in order to select patients suitable for new therapies. That's very exciting.
Wow. Well, you're doing very important work. Thank you so much for sharing it with me today. All the best to you.
Thank you.
And congrats.
Thanks a lot.